I remember walking up the passage with my daughter and tears running out my eyes thinking, God, what have I done in my life to be here? But in the end, it was the best place I ever went to. I just keep thinking if I did ever have a relapse, where would, am I going to get the help I did there?
The closure of the Hobart Clinic has shocked many Tasmanians, and we're going to chat about that today with State Secretary of HACSU, Robbie Moore. Hi, Robbie.
Hi, Esther.
And Mick, a former patient of the Hobart Clinic. Thanks for joining us, Mick.
Not a worry.
Before we get on to your story, Robbie, so this closure, the shock closure, you would say, I mean, they're talking about shutting in October. This was the last private mental health facility in southern Tasmania. What does this mean for the community?
This is absolutely devastating news for the Tasmanian community and especially for southern Tasmania. If you have a mental illness, there will be no longer a private facility available if this was to go ahead. We can't let it go ahead for a lot of reasons, but what the announcement is that it will be closing. It will be fully closed from October the 31st, but it's likely the last patients would leave on the 17th of October, which is not far away. So that's why we need to see the intervention of the Health Minister. We're calling on the state government to do exactly what happened with HealthScope recently. They went into administration across the country, 27 different hospitals, and the federal health minister actually intervened and said, we're going to keep all of those hospitals open for 12 months and got a guarantee. We need to see the same thing here from the Tasmanian health minister to ensure that the facility stays open while we work out a viable future for the site and for the patients that need that service.
Why are they closing?
The announcement by the Hobart Clinic said it was closing due to its financial situation. They made a loss of $3 million last year. The reality is that there is some issues for the hospital, but the basis of their financial position really is they had a really bad CEO for the last 2 years who's just left. They lost a lot of their psychiatrists because of poor leadership, and that meant that they were getting locum psychiatrists, which cost a fortune, and no wonder the clinic's made a loss. If you could get permanent psychiatrists back there, you could make that business to make money rather than lose money. So we know the solutions are there. They've got rid of a really bad leader, but they just need to put the right leadership in place to get this place to be viable and ensure that it's ongoing.
Having spoken with many patients as well, it's almost as though the Royal is more of a holding facility. It doesn't have the services there that, say, a clinic would have.
The health system is not equipped to cope. I got a text message on the day that it was announced from a nurse who said they had a patient in the emergency department at the Royal waiting for a psychiatric bed for over 70 hours, and they were still waiting there and then. And yet the health minister made a comment to say that they could absorb these patients. They can't. The system isn't coping in the public system, and that's why it's so important that we have this private facility and those beds, as well as outpatient programs, continuing to happen while we work out a long-term future.
Mick, you're a former patient of the Hobart Clinic and you've credited it with saving your life.
Definitely.
Can you tell us, with whatever you're comfortable with sharing, what led to you entering the clinic?
Yeah, well, all my work and life, I've been really a strong-minded person. Had a few businesses, but the last one, it was pretty well down when we took it over, but built it up. But it kept building and building, and in the end, I was just physically buggered. I just wouldn't leave the place alone. Even if I had a day off, I'd be on the cameras watching it, running to the businesses at 7 days a week. And yeah, so in the end, I was mentally and physically just exhausted. And so it was bringing different things up in my life, and there was other things happening as well, but just one day the 3 or 4 things all collided, and I'm still lucky to be here. That's the reason I went in.
And you went in with your daughter, is that?
Yeah, well first my daughter just made me get in the car one day to stay and took me to the Royal Hobart Hospital. We sat there for 10 hours. And I said, Melinda, I just got to get out of here. So she said, no, we went to Calvary, Hobart Private, I think St Helens might have been open at the time. Went everywhere and they just kept telling us we've got to go back to the Royal. So went back. I said, I've had enough today. It was, by that time, 6 o'clock at night. She said, right, I'm bringing you back at 6 in the morning, which she did. We sat there probably for another 8 hours, seen the psychiatrist. They put us on to the Hope at the clinic. And I remember walking up the passage with my daughter and tears running out my eyes thinking, God, what have I done in my life to be here? But in the end, it was the best place I ever went to. The nurses are so good. They're trained for this. And I remember going out one day and that outing knocked me around a bit. I come back in, went straight to my room, and he come in, the male nurse come in, and he said, I could tell you're not good, what's going on, and he talked me through it. And yeah, I just feel sorry for the people to come, because in my time in there, I talked to 6 or 7 people that was in the same boat as me, nearly took their lives. I think the government should take it over and move, all the patients from the Royal down there and even make that a bit bigger, because they need room. Yeah, I just think it's a disgrace.
Oh, one more thing that I would add in relation to this situation is the reality is that with the government taking it over, they still can get the private health payments for those people. So it's actually a revenue for the state government. And they currently do that in public hospitals. If you're a private patient and that's identified, the government get paid by your private health insurer. So it's actually a way to bring income into the government. And, if the facility is run correctly, it won't even cost the government any money or much money. So, and it'll provide such an essential service. So we just are so hopeful that the government make a common sense decision and take this over so that the community can get the mental health services that it definitely needs.
Why the reluctance? Because I know you've met with multiple health executives in the state. Why is there the reluctance to do that?
The major reluctance seems to be with the capital upgrades that would be needed, that the roof has some mould apparently and there's a wall that needs rebuilding.
They should see my house.
Yeah, exactly. They're not major projects for a government. They're one-off funding to do those upgrades, so it's not part of reoccurring payments that the government have to make. So it's a no-brainer that they just will have to do that. But, sometimes you've got to spend money to make money, and in this situation, they definitely can make money out of it, and it can pay for itself.
Well, mental health can't wait, can it? It's not going to wait until there's a better bed or the right infrastructure, and it's a huge block of land that it's on down there. Mick, how do you feel knowing its closure?
Oh, I'm devastated. Like, I just keep thinking, if I did ever have a relapse, where would, am I going to get the help I did there? I just can't see it. Like, they say it's going to go out to the public sector, but they're all overflowing it anyway. And which one's got 27 beds? Is there any in southern Tasmania? I don't think there is.
No, there's not. There's no capacity anywhere to do this. There is a Peacock Centre. It has 12 beds, but the reality is that we need these 27 beds. The system isn't coping now. People are having to wait a long time, whether it's to get into the Hobart Clinic or certainly to get into any public services. And this is just going to add hundreds of other patients to the system, and there's no room or capacity. So that's why we need the Health Minister to intervene now and guarantee that services will continue for 12 months.
And the impact on families as well, friends, there'd be a real fear amongst, you talk about how you went to the Hobart Clinic, your daughter helped have you admitted.
Yeah, especially that day Belinda broke down, I knew I had to go. She was that worried, It's just a disgrace. It's shutting like it. Yeah, I don't know what the answer is. The government's got the answer.
I think Mick makes such a big point there around family members, that this doesn't just affect the people that need the services. This is people that are impacted because they're seeing loved ones suffering so much and going through so much, and the impact it has on everyone else. So, this isn't just about the, probably 1,000 patients they see a year. It's about 5,000 people, and then it impacts on their mental health, and there's a flow-on impact. So this is going to affect so many people.
Mick spoke about the mental health nurses there that, again, as you said, saved your life. How are they feeling?
Look, the nurses, along with all the other staff, the allied health professionals, to the cleaner, to the psychiatrist, look, everyone is devastated. Yeah. And despite the fact that they're obviously very worried about their own personal situation, they're more worried about the patients that they care for. The reality is these patients will have nowhere to go. These staff are specialised, some of the best mental health staff in the country, and we'll probably lose a number of them to interstate because they want to keep doing the same work they're doing now. We can't afford to let this happen. It's so important that we fight to keep this service. Then I have grave concerns for people's safety and for their mental illness and for their family and the impact that could have. I think we all, know the impact on a family if somebody takes their own life, and that can ruin other people's lives and does. So we've just got to, we've got no alternative but to really fight to keep the Hobart Clinic open and see the services continue, because if we don't, it's going to have dire consequences.
That's the other thing we're not going to hear about them either. How many, I was talking to 2 inpatients on Monday before I left, and that was pretty bad. What's going to happen to them, they didn't know. And like a few people we know that go in and out, they need to go back in when they do, and they've got no idea. They haven't been told anything, and so, it's just a shame.
Robbie, what is HACSU currently doing at the moment, and what are you fighting for in this campaign?
So we've started lobbying already to politicians and to key decision makers within the health department to keep the centre open. We've also launched a petition as well, because we've been inundated from community members that are so devastated at this news that either use the service themselves or have seen their relatives, use the service, or friends. So we're going to fight really hard because we've got no other option. We cannot let this service go, and we're going to campaign for as long and as hard as we need to ensure that the facility stays open, gets the upgrade it needs, and continues to offer both its inpatient and outpatient services into the future.
And the petition Robbie's talking about is in the comments below on this page, on this post. Mick, what would your message be to the government?
Please take it over and think of the people in the mental health and what it can do, How many people we're going to lose because your decision not to take it on, which there will be.